Welcome everybody to the first day of the podcast series for EHC World Hemophilia Week. Today we will be focusing on the community and especially on von Willebrand disease. With me today is Dr. Michelle Lavin. Michelle Lavin is a consultant hematologist in the National Coagulation Centre in Dublin. And we have with us Fiona Brennan, EHC staff member, and myself, Manon Degenaar Dujardin, and I'm the chair of the EHC von Willebrand Working Group. Fiona, over to you.
Hi everybody, thanks for joining us. Manon, thank you for the introduction, and Michelle, thanks for joining us as well and taking the time to have the conversation. We really want to put a focus on the future of von Willebrand's, and now we say that the time is right to really focus in on what's happening in the community and to strike while the iron is hot in relation to the newly launched VWD Guidelines. Michelle, why now? Why were the guidelines published for von Willebrand's and what's happening with them?
Well, I think just as you said, it's a really exciting time for both people with von Willebrand's and treaters of patients with von Willebrand's disease, because we have these new international guidelines. And for anyone who isn't familiar with it, they were actually a composite of 4 different organizations came together and collaborated. So we have the American Society of Hematology, the National Hemophilia Foundation in America, so the main patient organization in America, and the main global patient organization, the World Federation of Hemophilia, along with the main scientific community, the International Society on Thrombosis and Hemostasis. And those 4 organizations came together to work together to develop new guidelines. And why do we need them now? Well, because we've had lots of different guidelines that have applied to different parts of the world, but no one consensus international guideline ever in von Willebrand's disease. And it's been really exciting to have all these different organizations with different backgrounds and differing interests, but having a similar goal to try and improve care for people with von Willebrand's disease, and to really move forward awareness and diagnosis of this condition.
Excellent, thanks Michelle. That kind of answers my question about why these guidelines are different to previous guidelines in the past. It's this international collaboration from different areas, I suppose, is really beneficial.
And I think, Fiona, another really important point is that patient preferences and patient decision-making and shared decision-making is a huge part of these guidelines. So for every question that we have, we look at how should these recommendations be used. And it actually was looked at for every single question and every single recommendation within the guidelines from 2 perspectives, not only just from the clinician's perspective, but importantly from the patient's perspective. So if you see something that's a strong recommendation, the panel recommends, then that means for clinicians that most individuals you'd want to treat them with this intervention, but for patients that most patients would want that intervention. And then if you see things that are conditional, so they say, you know, that we would, the panel suggests, that means that for patients, the majority would want the intervention, but it recognizes that some may not. And that really comes down then for the clinicians, that different choices may be appropriate for different people depending on their values and preferences, and shared decision-making has to be employed with that individual patient. So I think this is probably the first time that we've really seen in an international guideline that the patient's preferences, outcomes were weighted just as importantly as the scientific rationale for why we were suggesting different options.
Absolutely, and that's great.
Excellent. That really sets the scene, Michelle. Thanks very much.
So, and we also had, obviously, sorry to interrupt you. We also had patients obviously involved in both the diagnosis and the management panel. So they had equal voting rights in terms of all the questions. And, you know, for every single question, it always came back to the poor patients that were involved, the weight on their shoulders. We asked them to represent their community, but just give us their experiences and how their experiences shape our suggestions and outcomes.
Yeah, and we talk about the importance of involving the patient all of the time, you know, and this shared decision making is so crucial to getting the services and the treatment right. So it really is paramount that the patients were there and had their voices heard. So that's great to hear. On that note, thanks for setting the scene, Michelle. I think, you know, it gives us a good framework to have this conversation between patient and clinician. So I'm going to hand over to Manon, and she has some pressing questions that hopefully will answer some of the questions that our community have about these guidelines.
Yes, thank you, Fiona. Michelle, I think the first question would be from a clinician's perspective. Well, how do you think these guidelines will impact your work?
Well, I think it's very helpful because we finally have consensus internationally, or we have recommendations to follow internationally. So we don't have, European treatment centres following European guidelines that may be slightly different to North American guidelines, that might be slightly different to Latin American guidelines. We now have recommendations that are going to be translated into major languages and used hopefully internationally. And that's really important for patients and people with von Willebrand's disease, so they're getting consistent care no matter where they are in the world. But it's also very important that in terms of advancing the field, because we can then look at research, because it's very difficult to know what treatments improve care if different treatment approaches are used in different parts of the world. So we're really hoping that this will help not only improve care right now, but drive forward research and improve care into the future.
Yeah, that's great. And I was thinking, from a patient organization perspective and patient education, well, how should we be aiming to use these guidelines?
Yes, that's a really good question. And I think that, von Willebrand's disease, even starting with the name, it's overly complicated. So it's really, if it was called the bleeding disorder, we'd all be a lot further along in terms of how we manage and make people aware of this condition. But in terms of there's two different papers. There's the diagnosis and the management, because it's a very big disorder to really tackle. So to try and break it down and make it simpler, they broke it into a diagnosis panel and a management panel. And you have to remember that for von Willebrand's disease, there's 6 or 7 subtypes of von Willebrand's disease. You're trying to make recommendations that'll try and capture all the nuances for all these different subtypes for all these different people with von Willebrand's disease. So it's quite a challenge.
Yes.
And I think that the diagnosis, reading the diagnosis paper, that's really more focused, I would see it as at clinicians in terms of how to reach a safe diagnosis, how to ensure you've checked everything properly so that you can say to somebody with certainty, this is their subtype, because we know treatments vary and responses vary depending on your subtype. First, assess a patient and what tests you should do. So that's really probably more clinically focused than the management side. And the management side is where we see changes for patients for certain. So, the very first question that was answered on the management side was about what's the role of prophylaxis, or looking at where prophylaxis fits in von Willebrand's disease. And we don't have a strong history of prophylaxis with von Willebrand's disease. It's something that kind of an afterthought, really, from both patients and clinicians. And we have a lot of reluctance to prescribe and to use prophylaxis. So this is all really born from the lack of studies and the lack of evidence, but it is trying to improve that evidence base to support the use of prophylaxis so that more people may have access to it. And I think a lot of the answers and a lot of the recommendations are really trying to support access and equity in healthcare. So we also looked at, when we made recommendations, would this improve or would this disimprove equity? So if you suggest you should have a very expensive treatment that might be only available to a minority of patients versus a treatment that may be cheaper and available to more patients, how would that influence equity and access to healthcare? So that was a really important consideration for the management panel as well. So I think as a patient, you're probably going to see more changes from the management paper rather than the diagnosis paper. The main changes that I would see, picking them out, would be the recommendation towards prophylaxis. There's a recommendation about a conditional recommendation suggesting the use of tranexamic acid in the postpartum, so after women deliver, to try and reduce the risk of primary and secondary postpartum hemorrhage. That's a big change for us now. There's a lot of our surgical guidelines are really recommending the different use of different follow-up assays in the surgical period. So they may remain largely the same in terms of how people's surgery is managed. But also, quite importantly, DDAVP trials are not now recommended for adults with low von Willebrand factor levels, or levels in the 30 to 50 IU per deciliter range, because that's an entire day of somebody's life gone and multiple blood tests over the course of the day. And one thing that before all this panel started, we did a scoping survey, and we asked both patients and clinicians for what they felt was important and needed to be addressed, and then focused our questions according to those responses. And it was really amazing to see the differences in opinion regarding DDAVP between patients and clinicians, with a very positive Clinicians were very, very positive towards it, and some of the patients were quite negative and had experienced some side effects. So it was really eye-opening for a lot of us to understand a patient's experience and perspective of what we would consider a very commonly used and effective drug. So, you know, the whole panel, the whole diagnosis and the management questions were framed around what clinicians felt the need were, where the needs were, and where patients felt the needs were in terms of their von Willebrand's journey.
Yeah, that's really wonderful that the two views are being incorporated and used to frame or work and make this guidelines. Well, I had two questions written down, but you already answered them because I was thinking about the change or improvement in the care, but you already stressed that. And I was also thinking on what will have the biggest impact in these guidelines, but you already stressed that as well. So I think my next question would be, from a patient advocacy point of view, how do you think these guidelines will help patients advocate for better treatment?
Yeah, well, I think it's very difficult to create a guideline that's going to fit every resource setting throughout the world.
Mm-hmm.
And undoubtedly, you know, we are biased towards higher resource settings where people can get access to, you know, testing that can be expensive and care that can be expensive. And I think it's important that as we move forward, both in haemophilia and in von Willebrand's disease, that we're not widening the gap between higher and lower income countries.
Absolutely.
So I think it's really important that we start left behind, because this is always a risk when you start making improvements, that some places will get those improvements and other places will have no change and be left further and further behind. So I think it's really important we don't forget about lower and lower middle income countries, because undoubtedly there's people with bleeding disorders that are suffering there and not getting the access to diagnosis and care. So that's something, you know, I'm incredibly passionate and aware about, that we have to always bring everybody up together. It should be a rising tide for everybody. I think it's important also that, you know, these recommendations don't fit every scenario for every patient with von Willebrand's disease.
Mm-hmm.
And there are gaps, and a lot of those gaps are because we don't have research and we don't have studies in these areas.
Yeah.
So what we really need is to have more calls for more research in von Willebrand's disease, so we can have more certainty about the recommendations. If you go through the guidelines, a lot of the recommendations are conditionals that we're suggesting, because we don't have high quality evidence to say this is definitely the best course of action. We have evidence that suggests that it's probably the best course of action, but without further and larger studies, and that's really going to involve collaboration between multiple organizations throughout different countries. But I think the patient organizations are uniquely placed to really advocate for that, to say, well, we want these questions answered. This is an important question to us. We need to understand what's the best way to treat my condition. So I think that what the guidelines have done is perhaps updated our practice, but also highlighted those areas that we really don't have enough information on. And we should be using this as an opportunity to fill those gaps.
Yeah, I absolutely agree. Because when the working group, when we reviewed the guidelines, even in the small group, and we're with 7 or 8 people, we found some things that to us as patients, they are very clear that there should be treatment for some kind of things. But of course, if we don't have literature backing it up, then there's a problem. So I think it's really great that we have these guidelines now, and that we identify the gaps and we work on them. Yeah.
Yeah, no,
Fiona.
absolutely. And
yeah, can I interject, Michelle, just to circle back to the comment around prophylaxis and a reluctance of, you know, maybe to prescribe prophylaxis, but also a reluctance of patients to take prophylaxis for VWD when it's available and accessible, which may come as a bit of a surprise to those who don't have, you know, prophylaxis available to them or accessible to them. What is, in your opinion, things that patient organisations could do to improve that? You know, we're talking about education and we're talking about advocating for improvements in treatment and raising that tide together. But what is it that we can do to encourage patients to seek that consistent treatment? Is there anything in your experience or practice that you've seen that works?
well, I think that if you have a lifelong history of bleeding, you normalize abnormal bleeding, and that's just, you think you're doing fine. And perhaps you know, those 12 heavy periods that you have that last for 10 days, so that you're bleeding for almost a third of the year, that's normal for you. So you think, well, I don't really want to take the injections, and how is it going to benefit me? Or I'm fine, I'm doing okay. So it's actually making people understand that their quality of life can be better, because if they have access to appropriate treatment, they choose to use it. But I think it's very difficult to do that, because it's not until you start, and it's true in haemophilia, we've seen this again and again, it's when people actually start and buy into prophylaxis and use it regularly,
Exactly.
then you see the difference. And
It's like, aha, finally, it can be like this.
this is what life is like.
Yeah, exactly.
I feel iron deficient all the time. So, it's a very big step, and it's very easy for me to take out a pen and write you up a prescription. I'm not the person that has to take on that burden of injections. So I don't think coming from clinicians is particularly helpful, because we don't take on that burden. The patients take on that burden. So I actually think peer support is probably the number one thing that people can use and to benefit from in terms of prophylaxis. So talking to people who have had prophylaxis and seen the benefit of it, learning, asking people, how did you learn to inject? How did you find it? I think peer support and hearing people's stories and experiences who have had their lives changed by prophylaxis, that's the real key to encouraging others. So I think, like learning from people like Manon, who have gone through, their experience of being sorted, that's really critical, far more important than any guideline or that anything I can ever say to anybody about prophylaxis.
Thanks, Michelle. And I think that's, one of the mammoth tasks of the VWD platform moving forward. And the focus of the VWD Working Group is to create that community at a European level, because nationally, they're quite small numbers. So that is one of the main objectives of the working group. I'm going to come to you, Manon, for a final question. From a patient perspective, what is, when you heard about these guidelines and we reviewed them in depth, what is, I suppose, the most exciting part of this for you and this journey throughout the VWD experience?
I think it's really simple, to be honest. I think it's recognition to see that internationally clinicians are focusing on the subject and working together with the patients. It's really a big deal, because when I talk to other patients, from Willebrand patients, usually what we find, and especially I'm focusing on the severe ones that do get treatment, usually the burden of not being heard or not being recognized is way heavier than actually the symptoms of the disease are to you. So I really am very happy with the guidelines, and seeing that internationally we are working together and focusing on this subject and working for a better treatment. So yeah, I think that would be my biggest yay moment with these guidelines. Yeah.
It's a pretty big yay moment, absolutely.
Yeah.
Come and ask Manon a question as well. I'm going to put you on the spot now, Manon.
No problem.
Where is the biggest gap in the guidelines? From a patient's perspective, where do you think that what hasn't been covered adequately? What needs to be looked at in the next iteration? Because I think a guideline is a breathing document, and it always evolves and changes over time. So, what would you like to see more research on, or where do you want more recommendations on?
Wow. It's always
Not just
difficult.
an easy question.
Yeah, it's always difficult to pick. But I think, of course, prophylaxis is one of the main things that I really would like to have more data on, because I know a lot of people, well, of course, we already seen it in some surveys that were done, that joint damage is way more common than we would expect in von Willebrand disease. But we don't have enough of, well, to see if it really is beneficial if we start prophylaxis. So that would be the first thing. And because I'm bad at choosing, so I'm just added second one. I think we don't always focus enough on the burden of the bleeds, because the joint bleeds, of course, and the muscle bleeds, of course, we know we need to treat them. But what I usually see in patients, not only in my own country, in my NMO, but also in Europe and even internationally, is that we don't have enough we don't look enough at the burden of the smaller bleeds, as in the nosebleeds. If they occur 3-4 times a week, that's a big burden.
Yeah.
And in my opinion, that should be something where you should treat more or more aggressively, because we see that the psychosocial burden is really big on von Willebrand patients. And I think sometimes there are a lot of traumas and burden that doesn't need to be there if we would treat earlier and don't wait so long and let the burden. Well, we sometimes say we von Willebrand patients bleed through life, and I think that should be a focus point as well.
Yeah, no, I think that's really important points. And like when you look at the quality of life outcome measures that we have in bleeding disorders, they're all designed for largely for haemophilia and for male audiences, not a kind of mixed gender audience. And you know, if you ask somebody with von Willebrand's disease, you know, if they have problems with nosebleeds, and you ask them, well, do you own any white or light blue shirts or blouses? You know pretty much very quickly how much burden of epistaxis or how much burden of nosebleeds they are. If they're afraid to wear anything pale in case they ruin it with blood because they're having such frequent nosebleeds. And a colleague of mine, Dr. Alison Dougal, who's one of our dental specialists in our coagulation centre in James's in Dublin, she does a lot of work on the quality of life burden from dental bleeding and oral gum bleeding. You know, you're smiling and there's blood on your gums, like
absolutely. That's a big part. Yeah, sorry to interrupt, but I was thinking about a story about a young girl. She's 15-year-old in the Netherlands, and she is really suffering from all the gum bleeds and bleeds in her throat. And she's at the age that she's really her self-esteem is not that well, because she knows she will. It's not a nice smell if you have blood in your mouth all the time. So I think, yeah, you're absolutely right. That's one of the things that we should look into. Yeah.
Thank you.
And because there's a huge focus on major bleeds.
Yeah.
Oh, sorry, there's a huge focus on major bleeds, but actually you're right, your quality of life can be more adversely impacted by trivial if they're interfering with the way you live your life.
Absolutely. That, I think, Manon, your point around, you know, people with von Willebrand's tend to bleed their way to treatment. We really need to focus on changing that narrative. And I think, you know, part of the EHC VWD survey, which will be hopefully shared with our community soon, will really highlight some of those quality of life issues that we've spoken about as well. And that's what we need. We need those tangible data-based outcomes so that we can really advocate for improvements in treatment for patients across Europe. So ladies, thank you both so much. I think we could have easily talked for another hour. There's a lot in this space at the moment to really be excited about and to focus on. So I doubt this will be the end of our podcast series. I imagine there will be more from the VWD platform to come. So thank you very much to you both, and we hope you enjoyed listening.